And joining us, the president-elect of the Private Hospitals and Nursing Homes Association, Dr. Prasanna. Dr. Prasanna, thank you very much for joining us today on this discussion. Really, right now, with all the stories that are going around about hospitals turning people away, people dying, hospitals don't really have a very good reputation right now in Bengaluru. How would you like to respond to this? What is going wrong? Why are hospitals turning people away?
Maya, first of all, I'd like to tell you why this is happening. We have been requesting the government to have a central allocation policy for all government and non-government patients, so that anybody who terms positive, COVID positive or a COVID negative patient, if they can be guided from a central nodal agency where the beds are available, the patient can go there. Now what's happening is the government is not doing that. So the patients are left to tend to themselves. They are running from post to pillar, going from hospital to hospital. Some hospitals are full. Some hospitals can't attend to COVID patients. Like you were mentioning about a patient delivering in the auto, some hospitals are not geared up to take up even COVID positive deliveries. So we need to have a central policy where we have a single number. Even though the government started a number with 1912 to attend to all the patients, it's been overloaded and congested, and none of them are able to get through that number. So this is adding on to the confusion, and in the patients are panicking and they're running from hospital to hospital. That's all this confusion is due to, which needs to be looked into by the government.
So an efficient allocation of one single number for centralized allocation, that would really help. What are the constraints then that the private hospitals are facing right now at this point? What are the difficulties, the challenges that you're facing?
See, the first challenge is when you get a patient, we don't know whether the patient is COVID positive or COVID negative. So you can't admit that patient straight away into a COVID ward. He may turn out to be a non-COVID, then he will get infected. If he is admitted into a non-COVID ward, he will infect the others if he turns out to be a COVID patient. So government has given some guidelines to allot some isolation beds to allot the suspect patients. But there is a limitation. Every hospital can keep about 10% of their beds for isolation beds to keep for suspect patients. Once they are full, you are unable to take new admissions. So this needs a centralized dashboard so that these patients are allocated according to the requirement and where they should go, and according to the locality they can be guided to the nearest hospital where the bed is available for a suspect patient when they are not tested. And second, the hospitals are having a huge shortage of medical personnel, mainly the nurses and the other paramedical staff. During the lockdown, we lost about 30% of our workforce who all went home to their native places. They did not come back. And another 20% disappeared from the workforce due to the fear of COVID infection. So all of us are working only with about 50% of the staff, where we are tend to attend 100% efficacy will be a very huge task. And 3 months of lockdown has already financially constrained the private healthcare sector a lot. So one side you have a financial constraint, you don't have manpower to work, and the government is insisting you give away 50% of your total bed strength to government allocated patients, which is impossible to work with.
So even though hospitals are required to admit people even without a COVID test, there are challenges there as well, and staffing a huge issue as well. But let us hope that everybody can really work together to avoid such terrible stories that we've been hearing about patients actually not finding beds.